Good evening and welcome to a very special edition of Have a Seat with Chris Hansen. I'm Chris Hansen, and tonight, I don't have to tell you that the coronavirus is gripping this country, this world in a way a pandemic has never gripped it in my lifetime and in a very long time beyond that. We are going to dig into the COVID-19 dilemma, the coronavirus, with two doctors who are on the front line of this issue. We started hearing about this, at least in the United States, right around February 5th, 16 days after a Seattle man returned from visiting relatives in Wuhan, China. He became ill and was diagnosed as the first case of coronavirus. Since then, we saw it explode in Washington State, California. It is in virtually all 50 states, and one of the hot zones right now is the New York, New Jersey area. And I have two guests tonight. I want to introduce, first of all, Dr. Suraj, who is the Chief of Infectious Diseases at Holy Name Hospital in Teaneck, New Jersey. We also have Dr. Maurizio Miglietta, who is a surgeon and critical care specialist who I've known for quite some time. He's worked for the government and consulted on a various number of emergency issues having to do with federal law enforcement and overall health and safety. Doctors, thank you for being with me tonight. I appreciate it.
Thanks for having us, Chris.
Dr. Saggar, let's start with you. You spent your entire day in the hospital at Holy Name dealing with multiple suspected and confirmed coronavirus cases. Take me into your day. How did it start? What did you see? What was going on?
Yeah, Chris. So as you may have heard, essentially Bergen County, where I practice in Holy Name Medical Center, is essentially the epicenter, if you will, of this outbreak, epidemic, and now global pandemic. We've seen a steady increase in cases over the last several days. Now, I should mention, we've been preparing this for a long time. We knew what was happening in China was not going to be contained. When you look at an outbreak, you try to contain an outbreak, and then you go to mitigation. So we knew that the containment of just isolating people, isolating contacts, was not going to work. So we've been preparing for quite some time, but I have to tell you, it's been a humbling experience in terms of the amount of patients, the amount of care that's needed, the amount of pressure put on healthcare staff. We prepare for this, of course. It's our job, it's our duty, it's our privilege. But the last few days have been unlike any days in my medical career, for sure.
Give me a sense, Doctor, of the scope of this. I know it's hard to give specific numbers and whether there have been fatalities or not, because you're still trying to get your arms around whether or not this was actually the coronavirus that somebody has, whether it's confirmed, suspected, or whether it's involved in an actual fatality. But give me the scope of the number of people and how serious their conditions are.
I'll tell you, it's all been in the news and in the media in terms of the problems with testing. We've had major problems at the federal level, at the state level. Thankfully, we ramped up our ability to test. There's still severe limitations of these tests in terms of how sensitive they are. We just don't know. Looking at some of the Chinese data, the tests are not as good as we would have hoped. But in terms of patients coming in, we've gone away from definitively diagnosing these patients and really presumptively. Because we know that in our area, in Eastern Bergen County and beyond, the amount of community transmission is very high. So that is, it's not direct contact with a case or someone who traveled from China or, let's say, Italy or Iran or South Korea. It's your neighbor. It's really just ingrained in our local community. So my team, my fellow colleagues, ER doctors, ID doctors, critical care, we very quickly become attuned to what to look for, signs, symptoms, labs, etc. It's really not really so important the number of confirmed cases. That number will continue to ramp up as our testing increases. It's really just identifying patients highly suspect and understanding while the majority do get better, the ones coming to the hospital are very sick. They do progress very quickly. And we really have to be one step ahead of this, essentially a race. We're staying ahead of the number of beds, the number of ventilators, the number of resources, keeping our healthcare providers safe, our nurses, our doctors. So it's very challenging indeed.
Do you have the resources you need? Do you have the ventilators you need? And I know early on there were estimates that we would need maybe in the hundreds of thousands of ventilators when this country only has in the tens of thousands of ventilators. Is that accurate? Is that going to be a problem?
we just don't know. We look at mathematical models of, possible percentage of our overall U.S. population affected. We say about 80% will have very mild symptoms, 15% moderate to severe, requiring hospitalization. We'll do okay with advanced monitoring, but at least 3 to 5% will require critical care, and that involves ventilation. And if we just do a quick mathematical model, that number could very quickly exceed the number of ventilators we have in this country. That, of course, is a worst case scenario, but we always have to hope for the best and prepare for the worst. So we've been early on ordering extra supplies, converting regular medical rooms to critical care rooms, ordering extra ventilators, extra masks, extra gowns, extra gloves, extra goggles, all things to keep our healthcare staff safe. Having said that, there is a real concern at this time that we may be overwhelmed. So that's why it's extremely important for the rest of the United States, for other healthcare providers to learn from the experiences we're seeing in the tri-state area, New York, New Jersey, and soon well on to the rest of the United States. Of course, the epicenter of the United States was Seattle. And so the data from there has been very telling, and it really ramped up our own internal resources and our own internal leadership team to really stay one step ahead.
And Chris, we've been following some of the Italian models where most of the hospitals in the area have ceased all elective operations and procedures, so that operating rooms, which normally have ventilators, are now being used as ICU rooms. So the ICUs themselves are starting to become filled with corona patients. So patients that are normally in the ICU are getting moved to the operating room setting where we have ventilators in those places. So we are learning lessons from other countries and utilizing all the resources we have at this point.
What are the lessons from China, South Korea, Italy, especially China? Let's start there. This was, something that we started hearing about, more than 2 months ago out of China. A massive crackdown starting with the Wuhan province, which is ground zero here. And yet you hear today, several weeks later, 90% of the Starbucks are open. What have we learned? What can we learn? What should we learn from China? Dr. Miglietta.
So I think some of the things that we learned that, number one, it's highly contagious. There were people that were likening it to the regular flu, but we know it's far worse than the flu. We know it's more contagious and it's more deadly. The Chinese were quite impressive in their approach to dealing with this on various scales, from social distancing to quarantine to spraying surfaces, streets, hospitals, public gatherings, to really grab a hold of this. And, they started hearing about this around New Year's Eve. And, it was really a testament to the Chinese, how they were able to build whole facilities within a week or two, hospitals, and that the way that they had mass quarantine stations and hospitals just dedicated to this. The system in the United States is very, very different. We're mixing hospital patients with COVID patients. We're not in the same type of society that is going to quarantine mass populations to a certain area. So from a social type of setting, the United States is going to have to come up with some novel solutions for this. And I guess that's why we're here tonight.
Dr. Saggar, is your hospital going to be able to handle this? Will there be people who, because of the treatment of those who have COVID-19, the coronavirus, displace somebody who has a heart attack or somebody who's in a critical car accident? When do we hit the breaking point here, do you think?
No, it's a good question. It's something that we are all concerned about. Like Dr. Miglietta mentioned, the idea of canceling elective procedures, things that can be delayed, is important so we can focus resources on the COVID-19 cases. Having said that, people will still have your normal strokes, heart attacks, trauma, all things that happen, unfortunately, in life. So we have to be really making sure that we don't divert our attention from those patients who also need critical care beds, medical care beds, surgical care beds, etc. Again, that's why it's so important for to have opportunities like this to really get the word out there. I mean, just a couple of days ago, right? The idea of having mass shutdowns of restaurants and social gatherings was unheard of. I know it's a lot in the news in terms of the new normal. It's very cliche, but it's true. You mentioned what we learned from China. What we learned is after 2 months of complete shutdown in Wuhan City, Hubei province, they only had 1 new case, and life is slowly but surely turning back to normal. The issue remains, can we replicate that level of mass quarantine, social distancing in our country? We obviously have a different, we're a democracy, we're free, we know that. China being a communist country can probably institute certain measures that we cannot. I think it's really going to come a lot to people's understanding how severe this is, how humbling this is, and the potential to overpower or overcome our healthcare capability with surge. That's the whole idea of social distancing. We're still going to have a lot of cases, but if we keep it below that critical line of where our medical system can handle it, then we're assured that people that need it can get the best advanced care that they can receive.
So from a medical perspective, that we talk about flattening the curve in the medical community, and I think we really need to, as a medical community, come together and really pressure the political atmosphere that social distancing and quarantining, whether it's self-quarantining or imposed quarantining, is really going to flatten that curve so that we don't overwhelm the medical community, run out of ventilators, run out of hospital beds, and so forth.
It's interesting. In New Jersey, where both of you are, there is a curfew. I believe it's 8 p.m. You're not supposed to be out for any reason. Limited travel. Mayor de Blasio in New York City today said that within the next 48 hours, he will decide on whether or not to shut down New York City. It seems like that's where this is headed. No subways, no buses, limited tunnel traffic, limited bridge traffic. Is that what it's going to take to get a handle on this and flatten the curve, as you gentlemen say?
Yeah, I mean, the reality is, in medicine, we don't think politics, we don't think economic. We're really looking, what can we do for the public safety and the public health? And the issue is this time, we know how transmissible this virus is. It is going to require rather, quote unquote, draconian measures, like really shutting down or limiting domestic travel. Already we're seeing, of course, shutdowns of restaurants, bars, movie theaters, but it really has to take an extreme level from central governments, local governments, and then also, of course, just really understanding of the average citizen that what the new normal may look like, at least for a small period of time, will enable us, of course, to go back to business as usual and life in the United States as we all love. But it is going to take some work now to save lives, later to shorten the severity of this disease. I mean, if you look at models in terms of what percent of the United States population may get infected, some numbers are between 30 and 60%. If you look at the fatality rate, at least on Chinese data, about 2%. Yeah. To put that in perspective, influenza is about 1%, so 20 times more fatal. Of course, viruses can change as they spread across the world. Our understanding is coming from the Chinese, but of course the Italians have a different experience. We may have a different experience in the United States. People are not homogeneous. There's other factors at play that we're still learning on a daily basis. I mean, it's really incredible how much information is coming out, how much we're learning. Like I said, it's extremely humbling as a physician for other healthcare providers. So we have to take everything with a grain of salt. We have to take stock of what's happening. And really just understand how serious this really is.
This is an unprecedented time, and it's really an unprecedented time, and it's going to take unprecedented efforts. And this is an all hands on deck, and I think this is going to affect every person in the United States at one level or another. This is all hands on deck. Everyone's going to be affected in some way or another. I say to families and friends who call up, they say, "How bad is this?" And I tell them as I look outside my window, I see cars, I see traffic, I see people walking their dog, I see people going to the supermarket, carrying on with their everyday life. And if I wasn't working in the hospital, and I work in multiple hospitals in the area, I would really have no sense of what was going on and the severity of the storm which is brewing. And Suraj said it great before. He had the analogy of a summer storm.
That's right.
You can be on one block and just a few blocks away, it could be raining, and on your block it's sunny, and it's kind of the same thing.
You know, scientifically, we understand that the most susceptible here are the elderly, those who have existing respiratory issues, the very young. But it is this middle area of millennials, which is a high percentage of this audience watching this show tonight,
Sure.
who can turn the tide here and flatten this curve. These are the influences of society. What do you say to the people watching tonight, many of whom are millennials, who are influencers, who can make a huge difference here by their behavior? What do you tell them, doctors?
So I'll tell you, I mean, from the Chinese data, it was those over 60, like you mentioned, chronic medical conditions, so smokers, underlying lung disease, heart disease, diabetes. But, you know, when you mention young, it does seem that, and the word's gotten out there, that those under 30, perhaps at least under 40, certainly under 30, for various physiological reasons, may have milder disease. Of course, nothing exists in medicine as black and white. There's going to be outliers, but as a bell-shaped curve, really those under 30 seem to be okay. However, they may be okay. They may be asymptomatic or have extremely mild symptoms. They can still infect others, right? So everyone here is middle-aged, right, or older. So being around someone who's asymptomatic, that's actually what we're learning more and more every day. I mean, the data here is changing very quickly. Someone can be completely asymptomatic, not have the cough, the fever, the shortness of breath, etc., and still walk into a bar, walk into a restaurant, walk somewhere, and still asymptomatically infect someone else. And that's very concerning. The data we're seeing is actually more than we expected. Initially, we thought, well, hey, it makes sense. If someone's sick, they're more likely to infect someone else. The idea of asymptomatically shedding this virus, that's what we call it, shedding, and infecting someone who's more susceptible is very concerning. So, you know, younger populations should not look at this as, well, it's not my problem. I can go celebrate St. Patty's Day. I can go to Vegas. I can do this. I can do that. They're still vital, if not more so, because you have to assume if you're sick, people get it. Okay, I better stay home. The idea is not if you just now at this point being sick and staying home. The idea is I feel fine. I still need to stay home. I need to telecommute. I need to only leave to get groceries, help out an elderly neighbor, pick up some meds from a pharmacy. This is not carte blanche to just hang out. This is what people really have to understand about social distancing and a kind of a own responsibility to help others in society. Again, not just the very old. I mean, we're seeing patients, a wide variety, it's being described, of ages. You know, people in their 40s, we're seeing cases. I saw cases, certainly, people in their 40s with severe disease. Last time I checked, 40 years old was not old. You know, I hope it's not. So,
Yeah.
but so that's where the responsibility, that's where the understanding of how, quote unquote, millennials, whatever you want to call the demographics, younger patients, younger people who may say, hey, I have no concern here. That's where they can really make a difference if they understand the impact they may have.
What is responsible behavior in this age, this very critical period of this pandemic of coronavirus? What should we be doing? Is it okay to go to the grocery store or the CVS for any reason at all? How close should we stay to home here?
You know, I mean, I think it's impossible to have people to stay at home, obviously, completely 24/7. And I also understand that there's socio and economic implications of staying at home. Not everyone has paid time off. Not everyone has a job that they can telecommute. But for those that can't, for those that have to go to work, like myself and Maurizio, you know, it behooves us that we're out and about to have less people around us. You don't want your healthcare providers getting sick. So in terms of staying at home, of course, if you have to go to the grocery store or the pharmacy, etc., you know, try to find times. And I know a lot of grocery stores are staggering the times they're open. Some stores are keeping certain hours early in the morning only for seniors, so they can get in and out very quickly with a less fear of being infected. But again, this is not a time to just think, well, I can go to the gym, I can hang out, I'm home from college, let me catch up with my buddies. I know it's difficult. As Maurizio mentioned, this is truly unprecedented scope, and it's going to take unprecedented measures like that from all facets of society to really make a dent and flatten the curve.
And I think you know, besides we know it's transmitted by droplets, so there's a lot of things that you can do to help prevent this, and I think that's another issue we need to bring up. You know, when you're coughing or sneezing, you're touching your face, you're touching your eyes, then you're grabbing the door handle, or you're grabbing a phone, or you're shaking someone's hand, or grabbing an article off of a supermarket area. Those are all things that may contribute to this epidemic. So I think being extremely conscious of that contact and that close contact is paramount, and that's where your audience can help out.
You know, one of the interesting things I saw was an article in the New York Times Sunday about two physicians in the Wuhan province.
Right.
Both worked at the hospital. Both were infected with the coronavirus. 35, 40 days into it, one sadly, tragically passed away. The other is virtually recovered. How can two people of the same age, 29, 30 years old, have two drastically different outcomes?
Well, like I said,
what does that say about the coronavirus?
Yeah, so we're learning more and more about this all the time. And one thing that is concerning, certainly, and causing anxiety for doctors, nurses, et cetera, is that those on the front lines are particularly vulnerable. The reasons being most likely that we're going to be exposed to people with what we call high viral loads. So they're more likely to transmit because they're obviously in the hospital and they're sick. I mentioned before, you can be asymptomatic and you can shed or you can transmit this to other people. But again, it makes sense that if you're very sick, very critically ill, you're going to have a higher amount of virus in your body and you're transmitting it. So healthcare workers are already stressed. They're not sleeping. They're not eating properly. We know these things are all important for immunity. So the immune system is depressed. You're now exposed to higher levels of the virus. And so we don't understand every single risk factor. You mentioned the age and the comorbidities. We know the receptor the virus uses in the lungs to gain entry. We very well may find that there's genetic variations in how much of that receptor is expressed. You mentioned younger millennials. The reason we surmise that they have less chance of having significant symptoms is they may have less of that receptor in their lungs. There may be other factors, other things like high blood pressure that may increase the amount of the receptor in the lungs. Again, this is uncharted territory. This is data that's constantly coming at us every day. We're learning something more. So I can't comment exactly why one would have a different outcome than the other. What I can tell you, there's going to be some heterogeneity in terms of patients' outcomes, even with same ages. You know, there may be confounding factors. We're seeing, at least in our own experience, a association with obesity. That wasn't described before, probably because the rates of obesity in China are much less, unfortunately, or fortunately, I should say, but unfortunately for the United States than we have here, where you have such a large percent of the population that is obese. And that remains to be seen, but that's something that we informally are looking at as independent risk factors. So again, multiple reasons for someone to have significant symptoms. And as Maurizio mentioned, someone may be asymptomatic, sneeze, touch a doorknob or touch a elevator button and walk away. And we know that these particles are very hardy. They can survive up to 6 to 8 days. So someone else who's older, we touch an elevator button, just touch their nose slightly, like we all do. We do it subconsciously and get infected. So again, that's really alluding back to what we talked about before, of the responsibility of all of us.
Do you worry about your own health and safety, both of you, being in touch with this, being in the middle of it? How do you keep healthy? How do you keep safe? How do you keep from spreading this to the family in the homes where you're sitting and talking to me tonight?
It is a significant concern. Maurizio, I'm sure, will share his thoughts. I'll just tell you that I have to do my due diligence and duty as a physician. He's a trauma surgeon. You know, he knows the dangers going in. ER docs know the dangers going in. Same thing with nurses. As an infectious disease doctor, I'd be remiss if I was not on the front lines with this. It's what we train for. It's what we took an oath for. I know it sounds kind of hokey, but it's really it's part of the nature of what we do. Having said that, we would be foolish not to take every single precaution that is necessary. So in part of our training prior to the onslaught of patients, we practiced safe donning. That means putting on and doffing, taking off protective gear. There's a certain way you put on your gown, then you put on your mask, your goggles, you put on your gloves last, a certain very specific way you take off the equipment. So we really have to just do our best to stay healthy, to protect ourselves. We call it PPE, personal protective equipment. But of course, in the back of all our minds, I would be lying if I didn't say that we were always worried about, despite our best intentions, I think there is going to be a high chance we'll see more healthcare providers afflicted. And obviously, we're very hopeful that they recover fully. But, other than trying to sleep, which we all are a severe lack of sleep, I would say just try and eat as healthy as possible and exercise whenever we can.
Maurizio, how are you staying healthy with all this going on?
I think, let me just go over a couple of things. I think, obviously we always think of ourselves as well, but being meticulous in how we approach patients around the hospital, how we use hand sanitizers, take the most precautions even when we're outside of work is really important as well. Things like even my mother is in a nursing facility. I'm not going to visit her for probably several weeks because of this, because I know the elderly at most at risk. And the last thing I'd want to do is infect my mom. So I think taking the proper personal steps to protect ourselves. But one of the lessons we learned from China was that healthcare workers are 3 to 5 times more likely to get infected. And in fact, and Suraj can tell you this, the first cases in our area were healthcare providers. Yeah. So we're already starting to see it hit our own people who are professionals and who really are meticulous about taking care of themselves. So in that sense, it's a little bit frightening. But at the same time, we did take an oath. Suraj and I go in to see patients, and we're seeing several patients. We go in and out of rooms. But I have to hand it to you. I'm humbled to be working with some of the nurses and respiratory therapists who are there for 8, 12-hour shifts, who are at a very sick person or dying person's bedside for 8 to 12 hours at a time, holding their hand and helping them. It's really incredible. So my hat goes off to all those people who are, on the front lines.
I think I speak for a lot of people who travel, who have, aggressive jobs. I rarely get sick. Several weeks ago, Gabrielle had a cold. I had a cold. It was nagging, but we didn't give it a second thought. All of a sudden, every twitch, every little thing, every runny nose, every sneeze, you're thinking, oh, God, did I not do something? Did I not protect myself? Did I not protect my family? Could I spread this to somebody else? I was in a hospital when my mother took ill. Your mind gets crazy. What should people be doing at home who maybe aren't in this high risk category, elderly, somehow compromised or very young? What should people be doing? Should they be sheltering in place? What should they be doing in terms of personal hygiene? When should they sound the alarm and go to a doctor and try to get something done here?
Yeah, it's a great question. I don't want to talk all doom and gloom here. It is important for those to realize that the vast majority of those that become infected will have mild symptoms and will recover 100% completely unscathed, right? We're talking about a certain small percentage, but again, a potentially large number. So small percentage, large number is still an unacceptable amount of patients. They may suffer what we call morbidity and even mortality. But we have to understand that current models predict it up as high as 60% of all the U.S. population are at risk of getting infected.
60%.
Yeah, so the numbers are looking 30 to 60%. It's a wide range, of course. These are models. Models take on a lot of complicated mathematical probabilities. But again, at the end of the day, they're just models. They can't predict the future 100%. But you have to understand that a lot of viruses are floating around out there. If someone's at home and have a little bit of sniffles, they have a little bit of cough, but they're otherwise fine, other than staying at home, which they should always stay at home for any virus, right? Not just for coronavirus, rhinovirus or the common cold, influenza. Social distancing, which is clearly the new word of 2020, is something we tell patients every year. So this is nothing new. So I think patients should not have anxiety of having some mild symptoms at home for a couple of days. They may very well even had coronavirus and recover and be completely fine. And until testing ramps up, there's really no reason for every patient with a little sniffle and a little cold to go get tested. And I'll tell you why. We don't want to overburden an already overburdened system where it's difficult for us sometimes to get tests on patients in certain parts of the U.S. that really need the testing. So I think that's important to note that, really mild symptoms, staying at home is just fine. The issue is when they sound the alarm, so to speak, is if they become progressive, meaning they're very severe. Now it hurts to cough. It hurts to take a deep breath. Before I was at home, I could walk it up and down the stairs. Now I can't walk up the stairs. I can't walk to the basement, walk back up. That's the issue. Again, not to sound the alarm, but to call your healthcare provider, kind of have a close monitoring. They may say, we'll use telemedicine, check on a phone, and you see how you're breathing. And again, if that continues, that's the time that one may need to seek care at a hospital. But again, I should make a mention, if they are, it's always best to call ahead so they can prepare for you, right? You don't want to walk into a room of other patients with other ailments unrelated. So the idea is that in an ideal world, if you're coming into the ER, you call ahead of time. They can put a mask on you, put you in a special area of the ER, and then assess, do you truly have a potential case of coronavirus?
And several hospitals in our area have started this by putting MASH-style tents outside of their emergency rooms to do the triage so that we're not mixing potentially infected patients with other ER patients.
Well, I think that's an interesting point, because I think that one of the things in the Chinese model that the Chinese did very well was to set up these testing facilities outside of the ER. They didn't send people to the Communist Party headquarters. It was completely separate. They had a massive construction campaign for these testing centers so these folks would not be exposed to the treated population. Is that fair?
It is fair. People talk about these drive-through testing sites. One thing I think it is important to note is that these tests are not perfect. So someone may come in and just say, you know what, I just want to get checked out. I don't have any symptoms. And our concern as healthcare providers is that someone may come in, get a test negative, and say, great, let me go hang out at a bar, let me go hang out at a restaurant, a coffee shop, go to the library, what have you. I think I'd be remiss if I didn't mention that these tests, the sensitivity is still unknown. So in other words, what are the chances you have a false negative? I think that the early data from the Chinese was not necessarily that reassuring that these tests were that great, especially early on in disease. That's why it's still important to still stay at home, because you may have a negative test and have a false sense of security, and very well a week later have symptoms, or very well may have no symptoms but actually be positive and still have the potential for transmitting to other more vulnerable populations.
And we've had countless cases where people are coming in with flu-like symptoms, getting tested, having an initial negative, and then coming back 2 days later with increasing shortness of breath, and then actually testing positive for COVID-19.
So let me go big picture here, guys, for just a minute. How do we prevent this? How do we sanitize? How do we clean an airplane, a hospital, a school, a subway, a bus, an Uber car, wherever? How do we prevent this from spreading? And obviously we talk about sanitizers and wipes, and if it's got alcohol in it, it's 99% effective. Dr. Miglietta, you actually are medical director for a firm that has technology that's called Nano Vapor Biotech. Tell me what that is. How does it apply to this pandemic? So,
as you know, many household cleaners are quite good at killing various microbes, whether they bacteria, fungus, or viruses such as the COVID virus. The issue is that once you've cleaned, if someone touches that surface 5 seconds later, or a minute or an hour later, you've infected that same surface. The good news is that our company, Nano Vapor Biotech, has come up with a solution. We have a non-toxic, water-based, no residue product that can be applied to any surface. And not only does it immediately kill the virus, but incredibly, our research is showing that it will kill the virus that comes into contact with that surface for up to 70 to 90 days.
70 to 90 days.
So there is nothing else that I know of that has ever been able to do this. This is a commercially available product that has been around for 20, even 30 years, that has been used in various commercial sectors, such as airplanes or maritime uses, but has never been used to this scale that we're hoping to in the healthcare community.
So this is technology that, for instance, was used to clean a fuel tank of some sort using this, and correct me if I'm wrong, dispersion type system, but it also has an application to disperse and effectively use antibacterials, antiviral chemicals to kill this virus for 70 to 90 days.
So this is nanotechnology. This is a molecule that forms these bonds that when sprayed on a surface using proprietary nanotechnology will create, if I can put it in lay terms, almost like spikes that point up. And when a virus or a microbe comes into contact with it, it literally breaks the membrane. And those spikes can stay into place for months and years. Again, this is perfectly safe. You can even put this on your hands, and your hands would kill the virus for up to 24 hours. So it's a very safe product that was used for another purpose in the past for the aviation industry and cleaning out tanks and taking out vapors to keep their workers safe, that we're finding is very effective based on our research onto human and canine dog coronavirus at killing them, which is pretty amazing.
And this is approved by the government, by the FDA?
Yeah, this is an FDA-approved product.
What has to happen to use this in the places we need it so critically now?
So we are ready to use this. We've been using this. Now is just increasing awareness throughout the United States and, quite frankly, the world, that we have this product. This is available. This could potentially be life-saving and a game changer in terms of preventing illness in a million different settings. It could be your church, it could be your school, it could be airports, it could be courthouses, it could be your airplane or the subway you're about to get on. Can you imagine spraying a subway car? I mean, think about being a patient. If I had a medical problem next week that wasn't too severe, am I going to think twice about going into a hospital that has just been exposed to corona, as opposed to saying, listen, this hospital was just treated with this compound and it is potentially protective. We're hopeful that it's protective for the next 2 to 3 months, so that if any virus comes into contact with it, it'll kill it immediately.
Is this a game changer?
We are hopeful that it is. We have some scientific evidence that is extremely promising. I think we're doing some confirmatory studies, but we do know that it does kill the virus. We do know that it stays on surfaces for 2 to 3 months. And we have very little evidence to show that it won't work. At this point, again, I said it's all hands on deck. We're going to use all guns against this. There is no treatment for corona at this point. So it comes down to prevention and strategies such as this, as treating surfaces that we will be touching now and a month from now, may be important at dampening that curve and preventing further propagation of this illness.
Nano Vapor Biotech.
Yes.
All right, we're going to put that link up here on this channel, and I'll put it out on social media too, so folks can become aware of this. I appreciate that. Here's a question for you, both of you actually, but we'll start with Dr. Saggar. If you went back and tested folks who believe they had the flu at the beginning of this flu season, how many people do you think would end up being positive for coronavirus?
Or look at those flu tests.
Well, actually, it's a good question, because actually coronaviruses come every year. We should 4 out of the 7 that affect humans are endemic. So we call seasonal. They come back every year. So they cause 1 out of every 3 type of upper respiratory tract infections in humans anyway. Now, this was first described and brought to the attention of WHO in the end of December 2019. So as far as we know, this specific novel or new coronavirus did indeed originate in the wet markets of Wuhan City and Hubei province. So I think if we looked early on this season, and if we believe that this truly originated there, this specific coronavirus, we call SARS-CoV-2. SARS-CoV-2 is the name of the virus. COVID-19 is a clinical entity. We would certainly not have seen any cases here. But it just shows you, as Maurizio alluded to earlier, how transmissible this disease is. At the end of the day, its fatality rate is not that high. It's not Ebola. It's not SARS in 2003. It's not even the Middle Eastern Respiratory Syndrome, MERS, of 2015, and certainly not Ebola of 2014. But viruses that have lower overall fatality rates often are much more transmissible, and that's what we're seeing, and that's what's incredible. If we, the Chinese are very skillful in their medical care. They very quickly identified the virus. They very quickly sequenced the virus and shared the information about the virus. So if that is described in late December of 2019, now we're looking at middle of March, already a global pandemic. It's incredible how fast this has spread. But if we looked at November, December, I don't believe at this time we fathomed that this particular virus strain was here. I think this is just showing how quickly it's circumvented the entire globe.
And Chris, it's obviously not the first virus, and it's definitely not going to be the last. And I think that's why it's important to emphasize prevention. Post 9/11, our world changed. We had to adapt. We had to go through increased TS line security, and it affected everyone in this world. I think this is a wake-up call to the world that viruses and pathogen exposure is on the rise. It is not on the decline. If you look at a timeline over the last 10, 20 years, there is no qualms about it. We are getting exposed to more and more pandemics and pathogens such as COVID-19. So in my mind, in the same way that we prevent for terrorist attacks through various multimodal efforts, we are going to have to do as a world the same type of multimodal prevention in order to attack this now and prevent future attacks.
When we started this show, there were approximately 100 deaths across the United States linked to the coronavirus. What can we expect out of this?
Yeah, so, if we are looking at that 2% or 2.2% fatality rate, which we're anywhere maybe between 2 and 3%, then that number is certainly going to grow. We know that more people have been infected, so that part of that number growing in terms of cases will be confirmatory testing. But we know that what we're seeing in the tri-state area, particularly New York and in Bergen County, New Jersey, is almost indefinitely going to be spreading throughout the United States. And so we have to be prepared, and certainly other healthcare providers, other healthcare organizations are heeding calls from Washington and now from our experience in New Jersey, are really being prepared for that surge potential that we alluded to earlier, and understand at the end of the day, there will be more tragic outcomes. We're looking at a vaccine was just announced for randomized clinical trials, and they're looking at that at University of Nebraska Medical Center in Omaha. There is some new compassionate use of Gilead's drug remdesivir. The Chinese have described other old antivirals and anti-malarial drugs, so actually old drugs for HIV and malaria. They have been FDA approved for a long time, now being looked at off-label use. And so there are encouraging signs of medications that may have some effect. We just don't know. But at this time, like Maurizio alluded to, for all practical purposes, we have no effective treatment. It's really all supportive care. It's proper infection prevention. It's proper personal hygiene. And of course, it's proper social mitigation.
How far will this go? How quickly will it spread? And what is the growth potential here realistically, based on the view the both of you have on the very front lines of this?
Yeah, I'll look at it as, not even the view that I have. The view is the highest infectious disease doctor in the land, Dr. Anthony Fauci has, from National Institutes of Allergies and Infectious Disease. I think we are several weeks away from the peak of this. And then that inflection point where it flattens out may very well continue for a very long period of time. So I think people have to be aware of been, discussing this with my colleagues. The beautiful thing I will tell you about the information age is how quickly information is disseminated across the world. Doctors in China shared things across the world to WHO, to the CDC. That trickles down to the state health departments and to local communities where we are. So it's very encouraging, really, I should say, how collegial it's been between physicians, even between other healthcare institutions, which you may know is sometimes can be political. There could be a lot of competition. Right now we've all agreed now is not the time to be political, or now is not the time to be competitive. It's really sharing information. We've been in touch with other institutions in our county. How many vents do you have? How many critical care beds do you have? If need be, we'll transfer patients from one institution to another that are stable, so we can prepare for an onslaught of more patients. That's very important. So that communication, constantly learning, sharing information is very key here.
So we know, Chris, that one person can infect up to 2.2 other people, and everybody talks about the bell-shaped curve. We are on the upward slope of this. I think we're still at the tip of the iceberg of what we're going to experience over the coming weeks. So I think your audience has to be prepared in terms of their home and personal preparedness in terms of food and supplies, but also cognizant that this is not going anywhere in the near future. And the key, again, I can't stress enough, is prevention.
What is your greatest fear? Maurizio, you first.
So I think people are not going to take this seriously. We've had even people on TV saying, it's just a flu. It's not just a flu. I think people are already starting to feel it. If you don't feel it because you're at home and you're watching TV and you're not near a hospital, it's understandable. But I can tell you from working in several hospitals in just my area, it is very real. It's something that we all have to take seriously. Are we all going to be okay in the end? Yes. I think just like China and other countries that have gone past the bell-shaped curve, and it's promising that China hasn't had new cases. We're going to be okay. But at the same time, why not prevent preventable deaths and transmission? And if everyone does their part, I think we can get through this.
Suraj, what's your greatest fear?
Yeah, very well spoken. I'll just echo what Maurizio already said. And my biggest fear is apathy. Again, I think people aren't taken serious enough. We don't want to be out there as Chicken Little and the world's ending. People have asked me, Doc, is now the time to panic? And I'll respond by, it's never a time to panic. It's just a time to be prepared. It's time to take it seriously. And, we alluded to that analogy of the summer thunderstorm, but, driving back from the hospital, you see people driving around on the roads, and just for a second, you might think, after a very stressful day, that, hey, maybe everything's okay. But, in the back of all our minds, there's still the idea, at least for some time, an impending, I don't want to say doom, but just an impending seriousness that people have to be aware of. People ask me, Doc, this will go away when it gets warmer, right? And there is no signs that this necessarily will slow down with the warmer months. We're seeing plenty of cases in Australia, increasing cases in the Southern Hemisphere, in Malaysia. So there's no guarantee that this will go away just when it gets warmer. I think people have to understand that what was normal a few days ago, and people say, oh, you're just worrying, you're being your normal worried self, is all of a sudden, the new normal. I mean, who would have thought that New York was shut down, Broadway shut down, all these concerts, restaurants, etc. And again, that still is not enough. So again, apathy is what I fear, but I also am hopeful that our public health system, our medical care system, the communication with our colleagues and our other fellow physicians, and of course, opportunities like this to get the word out will really help stem the tide of this virus and the possible potential disruption, which will be there. But at the end of the day, we'll get through it.
This may sound like a silly question to the both of you, but we've gone from Thursday, where in New York City, not far from our apartment in Manhattan, you could, between Whole Foods and CVS, get just about whatever you need,
right,
to being in Michigan this evening, a lot of things in short supply. The two of you being exposed to this potentially on your everyday level, what vitamins, what supplements, what diet are you on? What do you do to as best as you can, stay healthy without taking medication? Is there something that people should be doing? That's the question on many people's minds tonight, I think.
So, people have asked me that question. And should I take zinc? Should I take mega doses of vitamin C? There's nothing that ever has shown that any of those things makes a difference. It's really staying healthy. What affects the immune system? Stress. So if you can avoid stress, I don't think myself, but for the average person, avoiding stress, cortisol, we know when cortisol levels go up, the immune system doesn't function properly. What else causes cortisol to go up besides stress? Lack of sleep. We know a diet, it's the usual stuff, rich in antioxidants, fruits, vegetables, balanced diet, etc. But there's no magic pill here. It's really, people are always looking for a magic pill. I mean, again, washing your hands, not touching your face, not touching your mouth, not rubbing your eyes. We have to take more extreme measures being in the hospital and dealing with direct cases. But for the average person, it's really as simple as that. Plus, now we know extreme social distancing and to mitigate the stem of this virus. So again, staying home for prolonged periods of time, which we understand is unprecedented. But I give the analogy, our grandparents were asked to go to war. The average person, and I'm not making light, but just on a slightly humorous note, a lot of people are being asked to stay at home and just do Peloton or just watch Netflix. So the idea is we're asking you to stay at home. I acknowledge that there's social and economic ramifications of that, and I truly hope that help from above meaning the government can aid people so they don't have to make the decision just as a financial decision whether to stay home or go to work. But again, those measures will be incredibly helpful, much more than looking for a pill or looking for a vitamin or a mineral.
I would echo what Suraj says is, stick to your normal routine in terms of what you eat and what you do and the regular medications you take. I would make a side note that, there's some interest in things like the NSAIDs like Motrin or antihypertensive agents of the ARB type that may be implicating in making you more susceptible, at least in some of the early studies. So I think some people are going to have to watch out for that. People are saying sometimes vitamin D may have some protective role. You're going to hear a lot of snake oil sales probably in the next couple of weeks. But we really need to stick to the science of this and the scientific evidence. Those are the only two agents that I know could have a detrimental effect. I don't know if it's really clinically valid, but there is some concern. So I think if you have a fever, if you could take Tylenol acetaminophen as opposed to Motrin, might not be a bad idea. But really just taking care of yourself, exercising. I know it's hard because they're closing a lot of gyms in the area, but doing exercising at home and keeping yourself getting enough rest are part of the normal things you should do during these next couple of weeks.
I'm going to let you guys get some much needed rest here in a second, but before we say good night, I want to go first to you, Suraj.
Sure.
Final thoughts. What is the most important thing you want people to know tonight about the coronavirus? What should they be doing, and are we going to be okay?
I always tell people, no matter what your beliefs, you have to understand that viruses, bacteria were here way before we were, and will likely be here way after we're gone. So it is a natural part of our DNA. And we know that bacteria, oftentimes can be very healthy for us. So these are not things to always fear. But we know that novel viruses, novel bacteria have been part of the human, life story, really, since the beginning of time. So, I always joke and say, well, I guess I'll never be out of a job because unfortunately there's always something around the corner. So I would say, one, I hope that people were able to digest this in an easy manner to understand and take some practical information, to be concerned, but not to be frantic or in fear, to take personal responsibility, but also to be empowered that there are things, very real things and very easy things they can do to stay ahead of this. And again, I would also comment that because this is something that we know as ID docs, but the average person maybe is not always thinking about this. And again, all physicians, all healthcare providers, is again, it just stresses the importance of keeping entities like the WHO, the CDC, the NIH properly funded, so we can always be at the forefront and ready for this pandemic and for anything else that most certainly will affect us at some point in the future.
Maurizio, your final thoughts for tonight.
So really, Suraj summed it up very nicely, but I think personal responsibility, everyone has to do their part. And it all comes down to, if you're not infected at this point, is prevention of it. And prevention through social distancing, staying at home, washing your hands, being compulsive. And the government has its part too, cleaning up areas. China sprayed streets. It sprayed almost every surface that you could see of through these massive trucks, through men walking around spraying every surface. There's no doubt that had an effect, because this virus can live on surfaces. So if you're touching those surfaces, you're at risk. And that's why, that's one of the reasons why I came on to speak to you tonight, because we do have the technology now. We just need to get it out there and make people aware that we have a potential solution to take care of and kill the virus for weeks to come, rather than reinfecting ourselves. So I think prevention is the key.
Nano Vapor Biotech. I'm fascinated by this. I'm going to put the information up on all the social media, as well as here on the Have a Seat with Chris Hansen YouTube channel. Dr. Suraj Saggar, Dr. Maurizio Miglietta, thank you so much, gentlemen, for being here tonight. Get some well-needed rest. I will stay in touch, and our reporting on this is obviously far from over. Stay healthy, guys, and I appreciate it. And thank you for being on the front lines here.
Thank you for having us. Thank you.
All right, guys. Thanks so much. Speak soon. Okay. Boy, that's a lot to think about. The takeaway, I guess, is to do all the things that we've been talking about for the last couple of weeks in terms of hygiene, cleanliness, and don't go out if you don't have to. We live now in the world of elbow bumps and trying to stay out of each other's way and not spread this. But I can only imagine what it's like for these two doctors to walk into those hospitals every day and come face to face with this, and it's going to get worse before it gets better. Program note, we'll be back on our regular show, Have a Seat with Chris Hansen, that we air on Wednesdays, tomorrow night at 8 Eastern. We will get back into our investigation of Onision, as well as Davi Vanity. One of our guests will be Blair White, and I'm very excited about that. We'll also talk to the Huffington Post, as well as a former bandmate of Davi Vanity. So we'll continue our criminal investigations, and we'll stay on top of this coronavirus. Tonight from Michigan, thank you for having a seat with me. I'll be in touch soon. Take care.